Ahead and get started today. Welcome everybody. It's another Wednesday webinar. This is a co-sponsored. This is co-sponsored by Security Health Plan and Marshfield Clinic Health System. My name is Chris Bruni. I am the VP of Sales for the health plan. Pleased to be with you once again today. Jen Kiefer is our hostess with the mostest, and she will be running the broadcast today. We are going to be rebroadcasting a presentation that we gave at the school convention here about a month and a half ago or so, and it features one of our clients, Dr. Kim Hall from DC Everest. So she'll be in the introductions as we get started. But if you have questions, feel free to use the chat feature and send those off, and we will do our best to answer questions at the end of the presentation. Obviously, Dr. Hall's not here today to answer those questions directly, but we can do our best to get answers to those questions for you. This broadcast, like all of our others, will be available on our website, and Jen will actually send this out to everybody that pre-registered once the event is over, with any questions that we didn't get answered during the presentation answered as well. So we will make sure that they all get answered one way or the other. And again, if you do have questions, use that chat feature. If you do have to leave a little early, that's okay, but we should be ending by 12:30 today. So we're only showing a piece of this, but just to tee this up a little bit more. So this was a presentation put together between DC Everest School District and our occupational health staff, talking about things that they had done over time to improve employee health and productivity, and some of the key steps that they took in that process. So without further ado, I'm going to have Jen go ahead and hit play, and we'll enjoy this presentation, and we'll chat at the end. Thank you. I'm going to go ahead and introduce everybody that's on the panel today. We're going to actually take our discussion. It's going to be, the first part is going to be focused on Dr. Kim Hall, who is part of the DC Everest School District, and we're going to do kind of a Q&A with her on the study that was done, and then we're going to turn it over to Dr. Corey Cronrath, who's going to talk a little bit about the vaccine. So just a little bit of background about all of the people that are in front of you today. Again, I'll start with Dr. Kim Hall. She is in her 16th year as the Director of Human Resources for the DC Everest School District. She's got her bachelor's in social work from the UW Oshkosh and a master's in human and community research from UW Stevens Point. There, you asked me to bring in Stevens Point, I just brought it in. So a doctorate in educational leadership from Edgewood College in Madison, and she holds a certification as a senior professional in human resources through the HR Certification Institute. She also holds a senior certified professional credential through the Society of Human Resource Management. So very pleased to have Kim with us today as well. Without further ado, I'm going to actually just talk a little bit briefly. Actually, I'm going to let Chad do that. So Chad, how about if we go over, hand the ball to you, and you can kind of lead us into our discussion.
Yeah, thank you, Chris. I appreciate the opportunity to get us kicked off here with Kim and Dr. Cronrath. And I'll just briefly, speak about the importance of having a strong relationship with the school district. And in a pre-pandemic environment, having that strong relationship has proven really helpful on delivering customized, timely services for when the school districts need them. And that works best for teachers and employees and administrators in each school district. We recognize that there's foundational services and special considerations that need to be in account, and not all school districts are created with the same opportunities and challenges. And the pandemic has really accentuated that even more, that having a strong partnership to deliver timely and pertinent services. I know this case study highlights some of those important partnerships with the health system, and certainly would like to get us kicked off, Kim, with this case study predates up here in occupational health. And so if you could help explain a little bit about the method formed.
Sure. Okay, so we have had a long-standing relationship with Marshfield Clinic, and because of that relationship, we have had several initiatives that we have undertaken as a partnership. One of the ones that was most successful for us was our employment pre-screening process. we had found that we had several employees in the food service area and the custodian area in our paraprofessional ranks that were suffering from workplace injuries. And we problem solved that and thought, is our current testing really reflecting the work that's currently being done? Has that changed over time? Unfortunately, I think the district, we just kind of, you get into a routine, you do what you know, you do what you know, and we needed an outside expert to come in from Marshfield Clinic and actually look at the work that was being done. And we had some aha moments because of that, right? We had custodians that we had some rotator cuff issues. Well, when Marshfield Clinic came in and looked at their daily work process, we found that we had custodians that were lifting trash bags that were probably way too heavy to be lifting over the shoulder, right? And what happens is they would take those out, open the dumpster that was probably way too high for them to be opening and trying to lift that trash bag into. And our rep from Marshfield Clinic was like, let's talk about that, right? Let's have a step stool where they could get up higher to lift the bag less, or have a cutout dumpster and adjust your garbage cans inside. So it was very eye-opening when we brought that Marshfield Clinic staff in, because they helped us get out of that, this is our routine, and have blinders on. They helped us take the blinders off. Another area was some of the shoulder injuries that Marshfield Clinic pointed out. When we had dust mops, some of them were so big that it was very taxing on the person's body. And instead of buying a dust mop that was 6 feet in length, we went down to dust mops that were maybe 3 feet in length. And like I said, Marshfield Clinic had the expertise to help us put on a different lens and say, oh yeah, we could save money in work comp, but we have to do these things and spend a little bit to get into a different situation. In regards to our school nutrition, I think that's where Marshfield Clinic coming on site benefited us the most, because we had certain shelving that we were using to store items on, and that shelving was just too high for the items that needed to be on there weight-wise. Marshfield Clinic helped us measure that length-wise, weight-wise, and really come up with a good recommendation that this shelving should be lowered 6 inches, and we think that will prevent injuries. Instead of trying to lift the whole case of cans, break the case down and lift each can individually. Use a step stool. So that was the first part of the process. Marshfield Clinic coming on site, looking at the work that was actually being done by the employees doing it. The next phase of that translated into a team going to Marshfield Clinic to the pre-employment screen area and actually putting employees through the screen while supervisors were there to observe. Okay, so talk about a robust process, right? We had paraprofessionals that were having knee injuries. Well, they may be sitting on the floor with students. They would get up, twist their knee, we'd have a work comp. Marshfield Clinic came and observed that. When we took an employee to their facility, we actually had the employee sit for a period of time and then get up. And the supervisor observed this. It was realistic for what the job entailed. And then that was all documented. And so we knew going forward, when we sent a custodian, a school nutrition worker, a paraprofessional, not only would they be able to do the job when Marshfield Clinic cleared them, but Marshfield Clinic was also teaching them things as proper bending, proper stooping, proper lifting, and gave them a really good idea. Some of our jobs, custodian-wise, included a lot of walking. So it was like, you're not just going to walk a quarter of a mile during your shift. It might be up to 6 miles. And that helped at times where some potential employees were like, oh, I can't handle that. That's too physical for me. Or the pre-screen screened them out. So it was just a very good process from start to finish, very encompassing when we actually took our team to Marshfield Clinic and our supervisors observed and said, yeah, this makes sense. This screen will get us what we need.
So Kim, how did the employees respond? You talked about some of the changes you've made and how the studies went. How did the employees actually react when or respond to those surveys and things and studies as you were doing them? Did they accept it? Did they welcome it?
Sure. Well, I'll tell you what, I think the employees were so proud that we took the time to have an outside entity come in and observe their work, right? That's what they were talking about. Custodians in other buildings were like, am I going to be observed? How can, what do I need to do? So there was talk amongst our employee groups. And then when the employee groups heard that we were actually taking employees already on staff and having them vet our process, vet our pre-screen, it just created so much morale boosting. And when they saw things change at the workplace, like the smaller garbage cans, right? Instead of using a garbage can that's so huge that you can't lift the bag, it was reasonable. The dumpsters changed. That was reasonable. The food service workers, when they weren't feeling pressure to lift this heavy item so high, it was a total morale booster. And when they saw that their supervisors, management cared enough to take the time to do this process, it was a win-win.
Great. Have you actually seen it result? You talked about how it's helped in pre-screening for new hires as well. Have you actually seen how that's resulted in maybe changes in how you staff or the amount of staff or your approach to hiring those staff?
Yeah. What we do in the interview process after we go through all our questions and such, we actually provide our candidates with the pre-screened criteria from Marshfield Clinic, and we have them look at that. And it says, okay, I need to climb up a ladder 3 rings. I will need to do this. And we talk through that with them because there are some people that when they read that, they think, oh no, I can't do that, or I don't want to do that. I didn't realize that. So it has helped our interview process as well. It gives our candidates a more realistic preview of the job and for them time to think, is this something that they really want to do? And then they know that they will go for the screen and those things will be expected of them to complete.
Great. So you've talked a little bit about the case study and kind of some of the results, but let's go back in time a little bit. So before the case study started, how did you decide that you wanted to even do this? How did you develop maybe the relationship you've had with the occupational health team?
Sure. Yeah. There's been several things that we have done. At one time, we even had a group formed of local employers, and we were kind of like an advisory group. And so then if we did see an issue, we were having a lot of work comp, or we were having a lot of restrictions, or maybe there was a situation where we felt that we weren't getting disability paperwork on time, whatever the case may be, we would get together and talk with the rep, and the rep would go back and talk with the management team at Marshfield Clinic, and we would have understandings and protocols in place that the employers in the area were able to have input on. So that's really kind of how it started. And it works so well for me that there have been times that I have had unique employee situations where Marshfield Clinic, believe it or not, did not have a specialty doctor professional on staff that could assist us. But my rep, because there was such a great relationship there, was willing to find me someone. And that could be down in the southern part of the state, sometimes even out of state. So that meant a lot to me as an HR director, that I didn't have to spend my time trying to figure those things out, that I had a partner in Marshfield Clinic, even though they weren't technically getting business at that time, they were willing to go above and beyond and assist me because I was a current client.
Mm-hmm. Again, we're trying not to, we don't want to sell the Marshfield Clinic services here, although we think they're great because this is the organization that we're part of. But for all the districts out there that are scattered throughout the state, I mean, you have these opportunities available through your local, hopefully through your local occupational health provider, your medical group that's in your area. How would you suggest, Kim, that maybe a person in your role goes about establishing that relationship if they don't have one with their local occupational medicine provider?
Sure. Yeah, the way I did it was basically starting with a phone call, asking for a meeting, asking what services the provider can provide, because we don't know what we don't know, right? And I think that's the first step. And I really feel that having touch point meetings, maybe every quarter, this is going well, this is not going well, we maybe struggled with this, we could use some help here, and just keep that communication open and ongoing.
Mm-hmm. Great. So you've used the occupational medicine team for a number of other services as well beyond this case study. So I know we want to talk a little bit about flu, and we're going to kind of use that as a lead-in. And Chad, did you have a couple of questions related to flu clinics? Chad's team is really the team that goes out there and does all of this, and it's the nurses that work with Chad and work with our employer group. So I'll pass it back to you, Chad.
I appreciate it, Chris. Yeah, and before I talk about flu, because I think it'll lead well into our follow-on, part of this case study, another part of it was the customized package that Kim and our team worked through. And one of those components was the Care My Way and the Care My Way at Work platform that we have in the districts there. And so I'm curious to kind of to your thoughts about the Care My Way and maybe an example or two of how that's come helpful, during this time.
Sure. And the Care My Way, we were just rolling that out right before the pandemic hit. So we weren't able to use that to the fullest extent we were hoping. But what I can say, we did have a very unique situation using Care My Way once the pandemic hit. We had a potential employee that was not comfortable going to the clinic because of the pandemic situation. So we were able to put them through their pre-screening via Care My Way. They were more comfortable coming to a district building and doing that. So that was very helpful, because in that situation, I was able to hire an employee during a pandemic. And if the Care My Way wouldn't have been set up, I probably would have lost out on that employee.
Yeah, thank you, Kim. I think it speaks to a couple of things, and I like the customized, approach to our relationship, and I think this speaks to having it there, and also speaks to the future about evolving with those services as the time needs it. One of the things that happens every year that we know is the influenza season comes, and I know that this is a service that the DC School District Everest, takes, and does comprehensively. And so if you could speak to, that on-site relationship and how that works for influenza season.
Sure. In years past, our flu shot clinic would happen at our field house or at our admin building, and we would just host one location. Always worked well. This year was very unique. Our district took a stance of zero crossover. We did not want staff crossing over between buildings. So my request of Marshfield Clinic was a big one. It was a heavy lift for Marshfield Clinic. It was, I need a flu shot clinic in every building this year. And it was like, whoa, okay, we made it work. We had our schedules in advance. My department helped with the scheduling. The buildings helped with the scheduling. We had forms filled out in advance. And we had Marshfield Clinic on site at, I think it was about 10 different locations this year giving flu shots. And it worked well. And I think if I wouldn't have the relationship that I do have with the occupational health department, I don't know that I could make that ask. And I don't know that it would be heard. And that's one thing that I've appreciated with the relationship. When there's an ask, then there's a solution usually proposed.
Great.
Yeah, thank you.
And speaking of COVID-19, we've got a solution that we're working on with DC Everest right now, which I know Dr. Cronrath is going to be talking about in just a second. I did want to go back just a little bit because there might be quite a few people in the meeting here that are not familiar with what Care My Way is. So I'll just give a very brief overview, very brief. But we have two different platforms there. One is a telephonic platform where people can call in and talk to a nurse practitioner. They can get prescriptions and things prescribed right over the phone. They can go pick it up, and it's like a nurse line on steroids. Okay, and then we have the other piece, which is more technology, but it's basically you get an oversized iPad. It's got a screen, so you can actually have a virtual visit with the provider right from the workplace location. So that's called Care My Way at Work, and that's something that we started rolling out a little over a year ago, and then got into the pandemic here, and so it's had some starts and stops only because so many people have not been working at the work site. So it's something that we're rolling out to different employer groups that they can actually have this virtual visit take place in a private location within their own workspace, meant to improve productivity, decrease the absentee rate, increase the presenteeism a little bit, and then just from a convenience perspective, it's there and something that we like to see provided. And again, if you think of the Marshfield Clinic footprint, the Security Health Plan footprint, the whole northern half of the state, there's an awful lot of areas where there may not be a provider for quite a few miles. So for an employer, this is something that they can have at their work site. Needs to have an internet connection. That's the one thing that we got to keep working with. But it's a good solution for employers, or even in the DC Everest case where you're actually not that far right from one of our major locations, just a mile or so down the road, and but still the convenience for that employer is a nice thing. So at this point, Kim, any last thoughts that you wanted to share on the case study?
Well, and I was just going to say the Care My Way, that was actually an ask of the district from Marshfield Clinic. The clinic asked us to be a test site to pilot that, and so this relationship works both ways. Both ask each other asks at times. One other thing we did a few years back, we did on-site biometric screening, and that again was a big undertaking. We had instead of sending employees out to the clinic, we had clinic staff coming here and helping with our wellness initiative, and that again was scheduling at several different buildings and meeting the district where we were. So like I said, I think the key takeaways for me in building the relationship is to have the ongoing communication and building touch points along the way, and don't be afraid to ask.
Yeah, it's been an interesting year during the pandemic, because we're definitely, every part of business is still, it's a relationship business, right? So we're finding new ways to maintain our relationships, and having meetings like this is just an example of that. All right, I think we are back. Oh, there my camera comes back on. I think we're back, and thank you all for attending today. We did have one question that has come in, and it's related to Care My Way at Work, and it's a great question, and it's something that we're actually following up on, and I just had a conversation with the manager of that area just yesterday. The question was, when will Care My Way be made available to other school districts? Northland Pines has asked, and we have been in session all school year. Yeah, the issue is that Marshfield Clinic, as a health system, we have really curtailed during the pandemic our staff going out, and it does take our staff being out there to get it set up in the school district or any employer's location. We train a super user to more effectively manage that then internally when there's nobody there. So somebody that's got a little bit of a tech background and can troubleshoot if there is any issues, because again, it does need that internet connection, and sometimes users will have encountered, just like with any technology, some issues. So we do have that super user as well. We will be getting our staff back out there. All I can say right now is soon. It's coming very, very soon. That the staff that gets those set up will be actually unleashed to the public again and allowed to get out there to get these set up. So please, we appreciate your patience, but this is something that we want to continue to see move forward. And once that staff is released to do this again, which again should be this spring, coming up real soon, and we'll get those out there and get more of these set up. So we do have kind of a backlog of some of these that we want to get established, whether it's a school district or another employer group. We've got quite a few that we are placing and have placed, and more to come. So the technology does continue to improve, and I think the version that we're putting out there starting this spring is going to be much improved over the one that was there already in place. So sometimes patience pays off a little bit that way, but I think you'll be very pleased with the experience once it is out there. So again, be patient. We'll get those out real soon, and I will add that particular school district up in Eagle River, a place I frequent very, very often. I'll make sure that that's on our list and do everything we can to get those done real soon. Other than that, don't have any other questions, Jen, that have come in that I can see. So we will call this a day. Thank you very much for all of you who did attend today. I appreciate it. Again, this will be sent out to you as well as available on our COVID-19 page, which is, so if you go to the Security Health Plan site, we have a COVID-19 page, and then there's an employer tab within that. All of these presentations, so everyone we've done over the last year, will be out there, as well as this one. And this one should be populated in just the next couple of days. And again, look forward to having you back with us on another Wednesday webinar very, very soon. Thanks, everybody. Be well. Have a great day.